We have a safety net system, safety net being the behavioral health system that guarantees services, right? That doesn't guarantee services, and that's a problem.
The state's failing these people.
We can do more.
Robert Werthwein is the director of the Colorado Office of Behavioral Health. For almost a decade, the state has consistently failed to provide timely evaluations and mental health treatment to pretrial detainees who are thought to be mentally ill.
They'll be evaluated whether they are incompetent to proceed with trial.
For years, these mental health services could only be provided at the Colorado Mental Health Institute in Pueblo, and the space there and the staff are limited.
Through lack of funding from the state, the competency system really never developed and kept pace with the number of new referrals coming in.
Mark Ivandick is the managing attorney at Disability Law Colorado, which serves as the state's designated protection and advocacy system for the mentally ill.
Individuals would languish in jails without mental health treatment or competency services for months on end.
The backlog for competency services was so bad that in 2011, Disability Law Colorado, then known as the Center for Legal Advocacy, sued the State Department of Human Services and the State Psychiatric Hospital in Pueblo for violating detainees' constitutionally guaranteed due process rights. In 2012, a federal court ordered the state to decrease wait times and the backlog for competency services, but the state failed. So, in April 2019, the court ordered Colorado to meet strict timetables for both evaluating inmates and restoring their competency, or pay stiff financial penalties. For Werthwein, this ongoing violation of detainees' civil rights is Exhibit A in Colorado's broken mental health system, and it's costing taxpayers big money.
You're talking about more than $1 million a month that you are paying in fines.
Correct.
1.3?
Yeah, with a cap of $10 million for over 12 months.
Records obtained from the Colorado Department of Human Services show that referrals for both competency evaluations and restorations rose sharply in 2013, and the trend continues despite the court order.
That means we need more beds. And if we don't have those beds, those folks are waiting in jail to get for a bed.
And to taxpayers, that means millions more in fines. But Werthwein says it isn't just about the money, it's about families, and it's personal.
It's about what it symbolizes, that somebody is waiting. And it's heartbreaking. I mean, there's no other way to put it. I'm a dad of an adult son who has special needs, who I worry about law enforcement needing to intervene, and we've called law enforcement. It'd break my heart if he was waiting in jail.
In response to hundreds of Coloradans waiting in jails, the State Department of Human Services is adding 24 beds at the State Mental Hospital in Pueblo, supplementing the 70 beds that came online in 2019. And the state will, for the first time in decades, provide competency services at the state hospital at Fort Logan, funding 44 beds. But those are still years away. Also, a portion of the millions in monthly fines the state is paying is being used to house nonviolent, low-level offenders in a converted hotel in Denver, where they will get mental health treatment. In the meantime, the state has partnered with 2 local jails in Boulder and Arapahoe counties to provide on-site competency restoration, taking the pressure off the state mental hospital in Pueblo. It's called the RISE program.
So this is one of our patient rooms. This is a room with 2 individuals.
Ashley Gunterman is Director of Jail-Based Competency Evaluation and Restoration for the Office of Behavioral Health.
The optics are that it is still a jail. However, the measures that we've taken to change them are safety-based.
Led by the State Office of Behavioral Health and operated by a private clinical provider, the RISE, or Restoring Individuals Safely and Effectively program, is in this converted wing of the Boulder Jail. It aims to shrink the detainee backlog and get them treatment much faster.
This unit itself has an additional 18 patient beds, and our other location at Arapahoe County Detention Facility has 94 patient beds, and so we're able to serve a larger amount of individuals sooner.
But Gunterman says RISE is not the long-term answer, and there are no plans to expand it.
These programs are unique. They require a lot of unique programmatic factors to be considered, who we have deputy-wise, who we have clinician-wise, how we provide those services, and most importantly, who could safely succeed in this environment while receiving these services. And that is not everybody.
We're looking at other options, particularly building the outpatient part. We are focused on what we're legally being told by federal court to focus on, but the problem is much bigger. It's a systemic problem in the state of Colorado.
And it is the federal lawsuit and court order that are now forcing the state to review Colorado's entire mental health system.
Does the safety net actually exist in the state anymore, in a real sense?
The safety net that guarantees that you'll get services, no, there are no guarantees in Colorado if you don't have insurance.
That was the circumstance Kristen Lipsky was in when she was arrested. She is one of so many in Colorado who simply cannot afford the mental health services they need.
I'll put it this way, there are a lot of people who have no guarantee for services, so they are ending up in jail.
And that's exactly what happened to Forrest Williams. Despite his mother's efforts, he could not get timely or consistent mental health treatment, even though he had private insurance.
We want a stronger behavioral health system in Colorado, and we're working towards a strong behavioral health system in Colorado. Is it impactful enough and large enough and to the scale enough that it's keeping enough folks out of jail? Probably not. But ultimately, it's about being accountable, and not just the state, but all of us being accountable that are in the behavioral health system, that we are delivering on what we said we'll deliver on.
The failure to deliver adequate access to mental health care in Colorado has prompted Governor Jared Polis to form a behavioral health task force to evaluate the shortcomings of the state's mental health system and to develop a plan to address them.
You know, we've seen lots and lots of task forces over the years on behavioral health, on mental health. What makes this different? I'm
committed to make sure that we're talking about real changes for people.
He says that begins with finding out exactly how taxpayer money is being spent.
Now, I know that the $1.4 billion in federal and state funding for behavioral health is not fixing the problem. We've really got to take a serious look at that $1.4 billion and ask those two questions about whether we're spending it the right way and whether it's enough.
The goal is not only to complete the analysis, but to figure out how to deliver services to those who need it, including children, and to eliminate the backlog of those awaiting mental competency restoration. All that, and to begin implementation of statewide changes this year. It's a tall order, and it is unclear how this can be done with many basic questions still unanswered, like staffing.
We need a bigger workforce, and that's one of the areas that the Behavioral Task Force is looking at. Even if they built it, or having the people in the communities able to provide the care they're asking is challenging.
But the toll for not overhauling the system is even higher.
I think the price is far beyond just me sitting in a wheelchair, or the fact that the suspect is dead. His family and friends are affected. My family and friends are affected. So the price is much bigger than just what you see on a piece of paper.
Access to care, I think, is a huge hurdle that we need to jump and make it more known for those that need it and make it more accessible for those that need it.
We're basically playing, in a sense, a mental health counselor, and we only have a certain amount of training that allows us to do what we do.
I have certain people that I go to all the time, and I am on a constant first-name basis with them. And we're doing the things we can that we think we can help them with because the money's not there.
I was just constantly being told no, because I would call up where he was inpatient and say, look, this is like his third, fourth time, or whatever number we were on, and say keeps going and going, and he needs long-term help. He needs to become stable, and I was being shut down.
I knew I needed help, and when I was searching online, there should have been a clear path immediately for me to get the help I needed. It was always like a catch-22. It's like, I need insurance, but I'm so unstable, I can't hold a job to have the insurance.
If something doesn't get done or fixed, or a solution or an idea that can be put in play, we're going to continue to deal with this. And now, not only is my life, my partner's life, a neighbor's life, a citizen's life in danger because there's nowhere for them to get treatment.